Hey everyone, today I'm going to dive into an essential topic for healthcare professionals: the clinical significance of interpreting the anion gap in diagnosing metabolic acidosis. This concept is crucial in determining the underlying cause of metabolic disorders, and understanding it can significantly impact patient outcomes. So, what is the anion gap? Simply put, it's a value calculated from the concentrations of serum cations and anions. The formula is straightforward. Anion gap equals sign Na plus Cl plus HCO3. This equation helps us estimate unmeasured anions in the plasma. But why is it clinically significant? Let's break it down. Metabolic acidosis occurs when there's an excess of acid in the body, either due to increased production or decreased excretion. The anion gap helps differentiate the causes of metabolic acidosis into two broad categories: high anion gap acidosis and normal anion gap acidosis. First, let's talk about high anion gap acidosis. This condition is typically due to the accumulation of acids like lactate, keto acids, or toxins such as methanol or ethylene glycol. When these acids accumulate, they consume bicarbonate, leading to an increased anion gap. Recognizing an elevated anion gap can be a red flag that prompts further investigation into these serious underlying conditions. Now, normal anion gap acidosis, also known as hyperchloremic acidosis, often results from bicarbonate loss through the gastrointestinal tract or the kidneys. Conditions like diarrhea or renal tubular acidosis are common causes. In these cases, the loss of bicarbonate is offset by an increase in chloride, keeping the anion gap normal. So how do you apply this in practice? Let's say you have a patient with metabolic acidosis. By calculating the anion gap, you can quickly narrow down potential causes. An elevated anion gap would steer you towards checking for conditions like diabetic ketoacidosis, lactic acidosis, or toxin ingestion. Conversely, a normal anion gap would lead you to consider causes like gastrointestinal bicarbonate loss or renal issues. It's also important to note that some conditions can present with a mixed picture. For example, a patient with both renal failure and lactic acidosis may have a high anion gap, but also show signs of hyperchloremic acidosis. This underscores the importance of a thorough clinical evaluation and considering the patient's full clinical context. For a more in-depth discussion on this topic and practice questions, check out the resource on arterial blood gas interpretation at. It's an excellent way to test your understanding and reinforce these crucial concepts. Remember, interpreting the anion gap is a vital skill in diagnosing metabolic acidosis and can significantly influence patient care. So, keep practicing and stay curious in your clinical journey. Thanks for tuning in, and until next time, keep learning and stay sharp.